I keep looking at myself, smiling, going, yeah. I was shocked at the color. I was very happy with it. I just really can't wait for the finished product. Kind of excited. I've got a couple of questions because I did notice that my front teeth are translucent, so I want to ask her about that. I'm going to leave the aesthetics to her because I'm not really good with that kind of thing, and she is. So I'm going to ask her about the color, I'm going to ask her about the size, if she thinks it's 100% correct. And I know that my front teeth were longer before, so I'm used to that. I'm not used to this. You know, and so I'm looking, going, shouldn't they be longer? So, and I really have enough confidence in Dr. Foley that I'm just going to say, you tell me. And if you think yes, then I will, and if you think no, then we won't.
Hey Eva, how are you doing?
I'm good, Dr. Foley.
Eva, tell me about your veneers and the temporary veneers and how you've been doing with them.
I've liked them a lot. I keep looking at myself. I love the color.
Oh, awesome.
I do. I really love it. I've noticed that my front teeth are sensitive to hot and cold, whereas they were not before.
Okay. You do get that fluid, hot-cold sensitivity that comes through there with coffee, real cold things, so that's to be expected. And when the permanent ones get placed, it'll get substantially better, and will eventually be totally gone.
Will there be any space between the teeth at all? Or
Well,
are they
space
connected?
for flossing, but no, they will not be connected. We have them connected right now because we're using the strength for the veneers with each other, because we get more strength for the plastic if they're all connected in one piece. In the future, there'll be 6 individual pieces.
Oh, okay.
Okay, 6 individual veneers that you'll be able to floss on each side of it, work just like your other teeth did.
Okay. I noticed that my front teeth, or at least the one on the right, seems translucent, more translucent. Is it going to be that way with the permanent?
No, the temporary is made out of a plastic material, so we get a little bit more show through than we'd like. The temporaries are a little bit thinner in those areas, and you're seeing your natural tooth come through there. With the veneers, you're going to get an even porcelain all the way throughout, which will balance that out.
Okay.
Okay, so next time we get together, we're going to have the veneers here. We're going to let you look at them, decide if you like them or not. We want you to evaluate the shape, the shade, and all of that to approve them before we actually put them in. But I have every confidence in the world that you'll love them. The lab technician that we use is just fabulous, and they will be beautiful. We will be adjusting your bite and polishing the margins to make sure the fit is good and things like that. And then we'll bring you back in a couple days after delivering the veneers to make sure you're doing well and not having any problems, and to get some photos so we can see what a beautiful smile you have. Okay?
Excited?
I'm very excited.
Yeah?
I'm very excited, yes.
You're ready for this?
I'm very ready.
Yeah?
Absolutely. I've noticed a difference over the past week or so, and you know, I can see a difference in my smile. I can see, even just when I talk, I can see a whiter line, and that makes me very happy. I've been not covering my smile as much. I used to cover my mouth a lot, or I would smile smaller. You know, I'd know I was smiling, and I'd just be careful that make sure my mouth wasn't quite as...
Pretty smile.
I see white.
Do you like the
I love the color, yes.
Okay.
I think my eye teeth are too long.
Okay. They're a little sharp, is what I see. Just a little bit sharp, and we can just soften that just ever so gently.
Okay.
Now the nice thing I do, the first thing I've noticed too, is that before your front teeth were longer than these, just slightly. But when you smile now, your lower lip frames your teeth, and the lower lip comes right to the edge of your teeth.
Right, as opposed to it covered
and getting caught under them or over them, and you may have noticed that when you spoke before.
I did.
Now, do you like it like this?
Oh, yes.
Okay. And they're a lot less bulky, and we brought everything not too far in, because you don't want to collapse the arch, but just decrease that thickness of especially those 2 central teeth, and then brought the lateral teeth out that were tucked behind.
Right.
So now things are kind of flowing real nice and evenly. Yep. Okay, well, let's lay you back and put them on if that's okay with you.
Works for me.
Okay.
Alright.
You're cute.
Favorite. Okay. Have to be real careful because they are pretty troublesome.
What do you think?
They are pretty.
Alright. Alright.
White my floor teeth now.
Yep.
I did, right?
Yeah. Okay, well, let me get her in here and see what she thinks about them. Thanks.
So Eva, tell me how your teeth have been.
They've been fine. I'm really happy. I'm really comfortable with them. I've gotten a lot of compliments, which is the best part.
Yeah, good. Well, I notice now that I like the way your lips frame your teeth, and that just looks great on you. I mean, because when you smile, you just see this smile, and these teeth that are just perfect. I mean, they really do. They look natural too.
People will just say, "You have a beautiful smile," or "Look how white your teeth are." You know, that kind of thing.
Perfect.
People who don't know me.
That's exactly what makes my job very rewarding, and that's what I think is a success in what we do.
So I'm very happy with it.
Well, thank you.
Thank
I'm
you.
glad you are.